I have 3 children. Emily is my youngest. We live in Virginia. And when she was born, we found out she had had a stroke. So she was diagnosed with cerebral palsy when she was about 1. And with that comes whole body, muscular, and neurological issues. It significantly affected her life. I had been bringing her to multiple providers because she was complaining of pain in her chest. And so she was at the point where she couldn't even sit upright anymore. We finally figured out it was the scoliosis causing it.
Neuromuscular scoliosis is a very different type of scoliosis than idiopathic scoliosis. These tend to be a little bit more complicated because not only are you dealing with the scoliosis, but you're also dealing with the neuromuscular condition, which can also limit the way we can treat patients. Now, thankfully, Emily's not one of those. We can actually treat her using conservative treatments, even though we're dealing with a neuromuscular condition.
I started researching options for scoliosis for non-surgical options because Emily has had issues with anesthesia in the past. Emily has neurological scoliosis. And I didn't know if any of these people would take one, but I had seen that Dr. Tony had seen something like that before. So that's when I decided to contact him. When Dr. Tony first measured her, and when we got measured initially, it was a 120-degree curve, which is very severe in the world of scoliosis.
When we look at severe scoliosis cases that start breaking the 80, 90-degree mark, we start getting concerned about some other conditions that can be happening. Meaning, could there be some cardiovascular compromise? Could there be some pulmonary compromise when you start dealing with some of these bigger curves? And it's really unclear in terms of, are these curves actually pushing on something? Or is it just because the curve, as it gets bigger, gets really stiff? And as it gets stiff, it gets harder to expand the chest for patients to breathe. And with Emily, she was having a lot of pain in her chest and her sternum area when she would take big breaths in. She had pain when she was coughing. And as we improve the function of the spine by using our particular system and how we address scoliosis, she starts noticing a reduction in these levels of pain and discomfort. And I honestly believe this is because we mobilize the scoliosis. We make the scoliosis more flexible. And therefore, by making the curve more flexible, the patients can expand and move their rib cage when they have to breathe and function better. So primary improving the patient's function for her was our #1 goal. Greatly, we were able to actually reduce the size of her curvature as well. But as a result of improving function, these pains started increasing. She started getting more mobility in her body and her arms. And all this is definitely a huge plus, considering that we're reducing the curve in a conservative manner.
Last year, June, we came for a week of treatment, and she was in so much pain, she couldn't sit up. We came for 2 weeks. We came for 2 weeks, and at the end of the 2 weeks, the pain was gone. So that was a miracle. Yeah, so that's how treatment is going. So then from there, we knew she would respond to it. You know, there were a few bumps along the road. Initially, Dr. Tony didn't know if she was going to be able to tolerate all of his machines. There are all the different pieces of therapy. And she did, which was surprising. It actually felt good to her. So 2 weeks of that treatment made her feel like a different child. Like her light came back on. I mean, it was a miracle.
The goal for our treatment is a conservative approach to improve function. And so therefore, myself and my staff, we are focused on connecting with patients in a unique manner and not just trying to get a structural result, because ultimately scoliosis is a structural problem, but we're really trying to improve their function and well-being. And by doing so, you have to connect with the patient, understand what's important to them, because not all patients just want maximized structural reductions. Maybe they want functional improvement, they want pain reduction, they want cosmetic improvement. So it's whatever the patient's needs are is what myself and my staff are focusing on to try to deliver what they want.
Well, his support staff is amazing. I mean, yeah, I should have mentioned them right off. I mean, it's like such a well-oiled machine. It's just an incredible organization. He's really done it. If you're at all wondering if this might work for whatever situation you have, call, because we were a case that really shouldn't have been able to respond, and we did.
I love scoliosis, reduction,